Welcome back. We are answering your questions about the coronavirus and stress with Cone Health's Chief Physician Executive, Dr. Bruce Swords, and Clinical Director of LeBauer Behavioral Medicine, Dr. David Gutterman. Remember, you can text us your questions. The number's at the bottom of the screen. All right, Dr. Swords, this person says, do you feel golf with friends is okay if we try and keep our social distance?
Yeah, trying's not enough. So I would say that being outdoors, away from each other and wearing a mask, you can do all sorts of activities, including golf, in that manner. But trying's not enough. We have to commit to doing this as a community, especially if you're playing with friends. There's no reason to infect each other. So go outside, stay away from each other, don't share a golf cart. And I think you can play golf safely. Just follow the rules.
Okay. This person is asking, if going untreated, how long could a person have symptoms of coronavirus? And then their next question is, doesn't the body eventually fight off coronavirus on its own?
Yeah, maybe I'll take both of those at the same time. And first of all, the caller is correct, and that is there really are not extraordinarily effective treatments for coronavirus. You might hear things in the news that are of interest, but our bodies really take care of coronavirus, and our bodies are responsible for healing our body. And so that's all true. Now, the people who get sick, their immune system may get so carried away that it really damages itself, and people get sick and can die from it. So all that's true. I think the other question was related to how long can you transmit or be sick from the coronavirus. We think that from the time of exposure within a couple of days, people can be contagious all the way through 14 days. And so if you are exposed, be extra cautious during that period of time, whether you have symptoms or not.
Mm-hmm. Dr. Gutterman, this person is asking, how can we better understand people that minimize COVID-19?
Well, that's a great question, and I think we all recognize that, unfortunately, in this unprecedented time, we're getting so inundated with information from a variety of different sources, some medical, some not medical. Unfortunately, I think there's the disparity, is that it's what people are paying attention to, and that's why I've implored everyone to please, listen to reliable medical sources, as Dr. Swords is saying, that we have available to us some of the best medical information in the world, if we pay attention to it, and instead of listening to various political sides about this, that we need to take care of each other, and it's so difficult to understand how and why it is that people it sometimes feels like we're in different worlds, but it is imperative that we take responsibility for listening to reliable medical advice that we have right here in our community, and look at the numbers, look at what's really going on, and not be in denial about what's happening. But it is difficult to understand when people aren't doing that. We can take it upon ourselves in a respectful way to try to educate people about where we've heard what we've heard without being judgmental, but to at least give people an opportunity to understand where your information is coming from.
All right. We all know that the president had COVID and then recovered. So this question is, why are people who are sick with COVID not given the same drugs that our president took?
Well, we don't know everything that the president took, and we do know that he received some medications. We think that lots of patients who are in the hospital have access to some of the medications, and he probably had some experimental things that may not be accessible. I am going to take a minute to pile on to Dr. Gutterman's comments around there are facts that we can look at and understand and all agree upon the facts, and that is soon our country will pass 10 million cases of COVID-19, and soon we'll pass 250 deaths. And there really just isn't arguing anything about that. And I love what Dr. Gutterman said is something to the effect of, this is a community effort. If we all take this on as a community and be accountable to each other and for each other, we can make such a huge difference just by our behaviors and do this as a proactive, feel-good community effort, and coronavirus goes away.
All right, we have a whole bunch of other questions in our queue. What I'm going to try and do is see if I can email them to you all and then put it in our web story so that we can get your questions answered, folks. We do appreciate you texting in your questions. Thank you, gentlemen, for joining us today.